Hi, everyone. This is Sarah Russell, and today we are going to talk about horses and zebras. Uh, what on earth is this, you may be wondering? I'm referring um, to a famous quote by a medical school professor sometime in the first half of the 20th century, who said, "If you hear hoofbeats, think horses, not zebras." So this quote has been often repeated, and it has been interpreted many different ways. The Some of them negative, because in a way it has led to um, to a situation in which patients have fallen through the cracks of less usual, less common diagnoses for conditions that are considered to be more rare. So sometimes people will go to their healthcare team, to a member of their healthcare team with a set of symptoms, and they sort of fall through the cracks because maybe the doctor hasn't been as trained in the more rare conditions and doesn't know how to recognize the symptoms, or B, they think that those are so rare that statistically it's almost impossible that somebody will come before them who actually has it. Well, statistically, if something is rare, it is still possible to see it. It also doesn't mean that the condition couldn't be underdiagnosed. So there are many conditions that used to be underdiagnosed that are being more commonly diagnosed now, but may still be underdiagnosed. For example, very common celiac disease. It used to be that very few people were diagnosed with it. As the medical community and the holistic health community have become more aware of the signs and symptoms, even outside of the gastrointestinal tract of celiac disease, more people are being tested, but it is still greatly underdiagnosed. And how do I know that? Because I'm seeing a lot of clients who come to me in their 20s, in their 30s, in their 40s, 50s, and 60s who have symptoms of celiac disease, and they have never been tested, even if in some cases they have a near blood relative with a diagnosis of celiac disease. And so, a lot of the time I'm the first person who suggests that they get testing, and they go to the doctor, and the doctor will run the tests, and oh my goodness, it comes back positive. And who knew? Who would have known? Who would have guessed? Well, that is what an underdiagnosed condition looks like. Celiac disease is not a rare disease at all. So think about something that is less common, more rare, and less commonly diagnosed. For example, hypermobile Ehlers-Danlos syndrome, which used to be considered extremely rare and then has been increasingly seen and recognized, to the point that diagnostically the criteria recently changed in 2017 in order to create two distinct categories, which is it's a little bit messy and not everybody's happy about it, but it does have its purpose. So now there are stricter diagnostic criteria for hypermobile Ehlers-Danlos syndrome, and everybody with symptoms that used to fall into the broader diagnostic criteria, but who don't quite fit or don't, who miss the mark by quite a bit, or just even by a little, or even by a hair, for the new stricter criteria for hypermobile Ehlers-Danlos syndrome, now fit into a broader category of hypermobility spectrum disorder. Does that mean that if somebody is diagnosed with hypermobile Ehlers-Danlos syndrome, that they are somehow higher in prestige than someone with hypermobility spectrum disorder? It doesn't mean that. It doesn't even mean, and this is something that that clinicians and scholars specializing in this area have said over and over again, as well as patient advocacy groups. It doesn't even mean that the person with a diagnosis of hypermobile Ehlers-Danlos syndrome is necessarily feeling worse or better than somebody with a diagnosis of hypermobility spectrum disorder. It doesn't even mean that one group is sicker than the other. They're just different diagnostic categories. Like I said, it's messy. And the most important thing is, can the patient access the services that they need for what they have going on? So bioindividuality is so much more important than the actual label that is placed. I think that we need to try to get away from this idea of the more unusual or the more sensational the diagnosis is, the more prestige the person has. Either, the more prestige the patient, or the more prestige the practitioner. It doesn't matter. What matters is the accuracy of understanding the patient's condition and their needs. So whether or not you are a healthcare practitioner who diagnoses conditions, it is really important to look with objectivity at your client's family history, personal health history, current diagnoses, and their current signs and symptoms to understand what they truly have going on versus chasing a trophy of a sensational diagnosis, or even, something that may be trending in social media, like specific types of parasitic infections. If somebody comes to you with a diagnosis of endometriosis, they have profuse bleeding, and they have menstrual pain, and they have iron deficiency anemia, you don't need to really wonder, what does this person have? They probably have not fallen through any diagnostic cracks. It all matches up with endometriosis, right? The question is, what can you do to help that person? That person needs to work with their allopathic healthcare team, specifically with a medical doctor specialized in endometriosis treatment, so that they can get the appropriate allopathic and, often surgical interventions to address the bleeding that is causing the iron deficiency anemia. The person may have fibroids in addition to having endometriosis, and that could be compounding the issue. Sometimes the fibroids just grow and they bleed so much, and there are many different surgical interventions for fibroids, many different approaches to endometriosis surgery. I've had clients who have talked to multiple surgeons who are specialized in the area until they found the best approach that was right for them, and that is what we call bioindividuality. It is a mistake to assume that somebody coming with a condition like that can just be supported holistically. We are causing delusions in our clients if we are, and even worse, we could be leading them astray from getting good treatment and prompt care, so they could their health condition could deteriorate over time instead of improving. The best approach for a client like that is for them to work with their allopathic healthcare team side by side with you as their holistic health provider, so that you're working on improving their iron absorption, optimizing their intake of foods that are going to support them, with hormonal balance, with support for digestion and absorption, with specific support against the inflammation that is part of endometriosis. You want to look at, in a situation of endometriosis and or fibroids, at foods that counteract whatever hormonal imbalance patterns may be in your individual client. So commonly estrogen dominance. You want to support them with foods that can help their bodies clear any excess estrogen without going to very heavy hitters that could imbalance them even more. You don't want to have them overcompensate to the point that you are depleting them. So going to those functional foods is always better than resorting to heavy hitting supplements at the beginning of someone's nutritional therapy journey. And you don't ever want to suggest to your client, either explicitly or implicitly, that holistic health and nutrition can replace medical treatment. It can't. Same thing, you wouldn't want to suggest to any client that because they have a healthy nutrition and lifestyle pattern, that they should avoid suggested screenings for specific conditions that are screened for in allopathic healthcare. Those screenings are still really important, because there are many factors in addition to nutrition and current lifestyle that can cause a person's risk for those conditions to exist or be elevated. So we don't want people to fall through those cracks either. It doesn't matter how unglamorous something like colon cancer may be, it is still quite significant. So, or breast cancer. Don't let people fall through the cracks because of excess confidence in holistic health. We live in a complicated world. We live in a toxic world, where epigenetically, genetically, toxicologically, our bodies have been changed by by all the decades and many generations of post-industrial exposure to chemicals that have changed us. They have changed our risks. So people do still need to be screened. That is still really important. People still need medical treatment for their health conditions. When you see somebody with who already has a diagnosis that matches their signs and symptoms, there's probably not much that you need to look for in terms of what has been missed. Don't go looking for the obscure parasite if the person's symptoms are already caused, fully attributable to the diagnosis that they already have, and just make sure they're getting the right allopathic treatment, and not neglecting their health. Some people think, oh, I'm just going to approach this holistically, and I'm not going to follow my medical team's advice. That is a mistake that a lot of people make. So you, as somebody who is working closely with your client, you can help steer them back into a multidisciplinary approach. They may not be working with the right medical doctor. They may not feel comfortable. Help them find someone that they are comfortable with in the allopathic world who can help treat their medical condition. We don't treat in the holistic health world. We support. It's different. We complement the work. We cross-pollinate with the allopathic treatment that our clients are getting for their medical conditions. So, ultimately, don't go chasing symptoms, and don't assume that somebody has fallen through the cracks if the diagnoses that their medical team has given them coincide with their health situation. So, to go back to the metaphor of horses and zebras, if you hear hoofbeats, look closer. Do you see stripes? If you don't see stripes, it's a horse. If you do see stripes, it's a zebra, most likely. So you could see a rare condition in someone, or not even a rare condition. It could be somebody has fallen through the diagnostic cracks for something that should have been maybe very obvious to their medical team, like celiac disease, which is not a rare condition at all, or something else. You can help your client if you're the person on their healthcare team who is working most closely and knows their health history best. You can help guide your client not to go against their medical team, or to feel defiant or angry with their medical team, but to collaborate more harmoniously with their medical team to get the diagnosis and treatment that they may need for conditions that may have up to that point not been diagnosed, whether they are rare or not. So that what is really important, don't pay attention to what the influencers are saying about just all these dramatic, sensational things that are causing a lot of anxiety in a lot of people. So on the one hand, I do want to acknowledge that some people with rare conditions that have fallen through the cracks, who have been gaslit by their healthcare teams, have, thanks to the awareness that is happening online and in social media, understood, what they needed to do in order to actually get a diagnosis for what they had. That is terrific. I am so grateful, both, as a human being and as somebody who works in holistic healthcare, that this movement has occurred. But the dark side of it is that a lot of people who have more straightforward issues and do not have anything rare, sensational, or dramatic going on with their health are going into this dark downward spiral of anxious, ruminating thoughts. They have joined a million Facebook groups where different people are just talking about these horrendous symptoms that they have, these rare things, and they think, oh, I might have that, and they are so worried that they could. I've even seen people who have spiraled down from mild anxiety to panic attacks to even psychotic breaks before they come to me, because they've been so worried about their health. They just pick up so much fear from the influencers and from these social media groups on health that they feel like they're completely broken, completely without hope. Their entire identity becomes wrapped up in the belief that they have something that they don't actually have, and they feel physically sicker than in any way they are. Sometimes a panic attack is just a panic attack. I'm not dismissing it. It can feel so severe. Why would you want somebody who has, you know, severe panic attacks to also worry if they have, a parasite and all these different toxicities? I mean, they might, but why don't we just start by helping our clients work in tandem with their allopathic healthcare team? Psychotherapy can be tremendously beneficial to people with anxiety and panic attacks. Just terrific. It can give them some amazing tools. And at the same time, we as practitioners working on nutrition and lifestyle can give them an incredible toolkit to help the psychotherapy piece integrate really well with nutrition and lifestyle, so that our clients may resolve their issues entirely. It doesn't matter at that point if they have a parasite. They may not. They may. If their health issue is resolved, they're good to go. If it ain't broke, don't fix it. If it's fixed, don't break it. So help your clients see themselves as individuals, as opposed to overly identifying with a collective need for validation. I totally understand what it means to fall through the cracks of diagnosis and and not to get an accurate diagnosis or an effective treatment. It is horrendous. It can make you feel so alone. But at the same time, the answer is not joining 100,000 Facebook groups that make you wonder if you have 100,000 different horrendous rare conditions. The answer is a collaboration between the person's allopathic medical team and the person's holistic healthcare team, where all the practitioners involved are doing the most diligent job at looking at the person for who they are, at their actual history, at their true needs, and distinguishing between the horse and the zebra. It doesn't mean that if your client is a horse, to stay in the metaphor, it does not mean that they are less special. We are special because of who we are. It doesn't mean that we're more special if we have a more rare diagnosis. I mean, your client may have a rare diagnosis. They're not more special or less special than the person with celiac disease, just because celiac disease is more common than something else. We want to approach the issue for what it is, as opposed to how rare or special or dramatic or sensational it might, just like that call of the shining object that you chase after. What is going to help your client and you the most is looking at things as objectively as possible and helping your client for who they are from a bio-individual perspective, versus, being misguided by influencers into chasing the most rare and sensational thing possible. It is important to follow the tracks all the way to the zebras when that's where they lead. But when they don't, you're going to lead the person astray and possibly make their mental and physical health worse instead of better. So all I want to say is, let's please honor our clients' bio-individuality and encourage our clients to work harmoniously from an interdisciplinary perspective with their allopathic and holistic health providers to get the best, most accurate healthcare that they can, without falling into the spiral of anxiety that is unnecessary for their health. So thank you so much for listening. Please let me know what you think. If you have any stories to share, any comments, I would be happy to hear those. So please don't hesitate to comment or to email me, and I'll follow up. Thanks a lot. Bye.